It's Friday, November 8th, and this is the Daily Medical News, where we bring you clinical medicine's top headlines, as well as a closer look at the day's biggest story. I'm Nick Andrews.
And I'm Molly Collegio. Today, probiotics cut spinal bone mineral density loss in postmenopausal women.
Insomnia symptoms may boost the risk of stroke and heart disease.
There's more evidence that statins reduce liver cancer risk.
And ketoacidosis is on the rise in children with type 1 diabetes.
Plus, why younger adults with type 2 diabetes are shouldering a significantly heavier cardiometabolic risk burden. But first, thanks again to everyone who's helped us make this podcast better by taking our short listener survey. For those who haven't, we invite you to take a moment to complete the survey by following the link in the show notes. And now, the news.
Postmenopausal women who took a probiotic with 3 Lactobacillus strains had significantly less lumbar spine bone loss compared with women on placebo. In fact, the University of Gothenburg researchers say they observed close to complete protection against lumbar spine bone loss in healthy postmenopausal women. In a study published in The Lancet Rheumatology, the researchers randomly assigned 249 healthy postmenopausal women to receive either probiotics with 3 Lactobacillus strains or placebo once per day for 12 months. After 12 months, there was a significant reduction in lumbar spine bone mineral density loss for women who received the probiotic. Those on the placebo saw a significant loss in spinal BMD. Time since menopause seemed to make a difference. The women who took the probiotic sooner after menopause saw greater protective effects. But don't swap probiotics for bisphosphonates. The researchers cautioned that the probiotics' effect on lumbar spine BMD was a lower magnitude than first-time bisphosphonate treatment for postmenopausal osteoporosis.
Insomnia symptoms increased the risk of cardiovascular or cerebrovascular disease during 10 years of follow-up. Researchers also found that more insomnia symptoms meant more risk, and that relationship was more evident in younger adults and in adults without hypertension at baseline. Investigators from Peking University in Beijing analyzed data from more than 487,000 people without a history of stroke, coronary heart disease, or cancer at baseline. Participants answered questions about having insomnia symptoms. After adjustments for confounders, each insomnia symptom was associated with a greater risk of cardiocerebral vascular disease. Compared with those without any insomnia symptoms, people with 1, 2, or 3 symptoms had a 7%, 10%, or 18% higher risk of total cardiocerebral vascular disease incidence, respectively. The researchers say using behavioral therapies to treat people with sleep issues could cut the number of cases of stroke, heart attack, and other diseases. The study appears in the journal Neurology.
Consider prescribing a statin in all patients with risk factors for hepatocellular carcinoma, regardless of their cardiovascular risk profile. That's the recommendation of Dr. Mohammed Talal Sarmini of the Cleveland Clinic. Why? Dr. Sarmini concedes the evidence that statin therapy reduces the risk of developing HCC does not rise to the highest A1 level, but the evidence at this point is sufficiently persuasive to back such a preventative approach. Speaking at the annual meeting of the American College of Gastroenterology, Dr. Sarmini said the recommendation includes patients with hepatitis B or C virus infection, as well as those with cirrhosis. But he cautions that the jury is still out as to whether non-alcoholic steatohepatitis is a risk factor for HCC. Dr. Sarmini presented a new meta-analysis, the largest ever addressing the issue. It included 20 studies, more than 2.5 million patients, and more than 24,000 cases of new onset HCC. The meta-analysis concluded that patients on statin therapy had a 43% lower risk of new onset HCC than those not taking a statin. And in patients with Hep B virus, there was a 45% reduction in HCC risk. Dr. Sarmini says the findings highlight the need for more cohort studies and randomized controlled trials of statins in populations at high risk for HCC. The Daily Medical News will be right back after this.
As many as 40% to 60% of children have diabetic ketoacidosis at the time of type 1 diabetes diagnosis, and the figures have been rising for the past 10 years. At the Barbara Davies Cancer Center in Denver, researchers found that the prevalence of DKA at diagnosis in children between 2010 and 2017 went from 41% to 59%, with a 7% annual rise. In another analysis of multiple U.S. centers and about 7,600 cases of youth-onset type 1 diabetes, the overall prevalence of DKA at diagnosis increased from 35% in 2010 to nearly 41% in 2016. In that multi-center analysis, researchers at Wake Forest University in Winston-Salem, North Carolina, noted that higher rates of DKA were seen in children who were covered by public health insurance than in those covered by private insurance. Researchers at Children's Hospital Colorado in Denver say the increase they found paradoxically occurred at a time of increasing health insurance coverage. What's driving the rising DKA prevalence? The researchers speculate that increased enrollment in high-deductible insurance plans could discourage families with private insurance from seeking timely care. Another factor could be the low awareness of type 1 diabetes in the general population. The studies were presented at the annual meeting of the European Association for the Study of Diabetes.
And finally today, young adults who are diagnosed with type 2 diabetes when they are 18 to 39 years old face a significantly greater cardiometabolic risk burden than their older counterparts. Patients in that younger age group had higher hemoglobin A1C levels, along with higher levels of low-density lipoprotein cholesterol and higher body weight. Those are the primary findings from a large United Kingdom study presented at the annual meeting of the European Association for the Study of Diabetes. University of Melbourne researchers also compared the incidence of atherosclerotic cardiovascular disease, or ASCVD, in younger and older adults with type 2 diabetes. They also examined how being high risk at diabetes diagnosis affected patients' risk of ASCVD and subsequent risk of death. The investigators identified more than 370,000 newly diagnosed type 2 diabetes cases in a national primary care database. 8% of the patients were between the ages of 18 and 39. Baseline hemoglobin A1C was highest in that youngest adult age group at 8.6%. The percentage of patients with a high LDL cholesterol value was lower among the youngest group than all but the oldest patients. But the 18 to 39-year-olds had the highest percentage of patients with a BMI of 35 or higher. The oldest age groups saw declines in all-cause mortality, but there was no significant decline in the younger age groups. The researchers caution that people with young-onset type 2 diabetes had ASCVD or all-cause mortality risks similar to those of older people. That was regardless of whether they were considered to be at high or low risk of events. And that's it for today's Daily Medical News. Be sure to catch the newest episode of the Cardiocast and the Post-Call Podcast. Cardiocast and Post-Call have new episodes dropping every Friday. For MD Edge, I'm Nick Andrews.
Our stories this week were contributed by Therese Borden, Doug Brunk, Steve Semino, Jeff Craven, Lucas Franke, Richard Franke, Sara Freeman, Denise Fulton, Alicia Gallegos, Bruce Jansen, Alexander Otto, Christopher Palmer, Jake Remley, Heidi Spleet, Michelle Sullivan, Gregory Twachtman, and Mitchell Zoller. Our editors include Terry Rudd, Kathy Scarbeck, Denise Fulton, Therese Borden, Katie Lennon, Glenn Williams, Richard Peasy, Laura Nicolaides, Catherine Nellist, Jeff Evans, Elizabeth Meshkati, Laura McGlade, Mark Lesney, Gina Henderson, and Catherine Hackett. And I'm Molly Collegio. And if you like what you hear on the Daily Medical News, please leave us a review or rating on Apple Podcasts. and check out the full stories available via the links in the podcast notes. Have a great weekend, and we'll see you next week.